Every year, millions of people worldwide suffer from pneumonia, a dangerous and potentially fatal infection. However, walking pneumonia is a form of pneumonia that is frequently disregarded and misinterpreted. Walking pneumonia, often referred to as atypical pneumonia or mycoplasmal pneumonia, is a mild form of pneumonia that can be transmitted through the air, frequently by unintentional carriers. We will examine walking pneumonia's definition, signs, causes, and available treatments in this tutorial. We will also talk about how to avoid this ailment and who is at danger. Walking pneumonia, what is it? The bacterium Mycoplasma pneumonia causes walking pneumonia. Because patients with this illness can frequently carry on with their regular activities without realizing they have pneumonia, it is known as walking pneumonia. Antibiotics can be used to treat walking pneumonia, which is often mild. Walking pneumonia symptoms. Walking pneumonia frequently presents with mild symptoms that resemble those of the flu or a cold. They could consist of a prolonged cough with little or no phlegm production is called a mild cough. A low-grade fever is characterized by a somewhat higher temperature, but not high enough to qualify as a typical fever. Fatigue, despite receiving adequate sleep, feeling worn out. Sore throat, discomfort or pain in the throat that can interfere with swallowing. Muscle aches, light discomfort or soreness in the arms, back and muscles. Who's in danger? Although everybody can catch walking pneumonia, certain groups of people are more susceptible than others. These consist of youngsters and adolescents. The majority of cases of walking pneumonia occur in school-age children and teenagers. Senior citizens, due to age-related immune function loss, older persons may be more vulnerable to walking pneumonia, those with compromised immune systems. Walking pneumonia is more common in those with compromised immune systems, such as those living with HIV or AIDS or on immunosuppressive drugs. Smokers are at higher risk for respiratory infections, such as walking pneumonia and lung damage from smoking. People with respiratory issues. Walking pneumonia is more common in people who have bronchitis, asthma, or chronic obstructive pulmonary disease, also known as COPD. Identification and management. Because walking pneumonia's symptoms might be confused with those of other illnesses, diagnosing it can be difficult. Walking pneumonia can be diagnosed by a physician using the following tests. Chest X-ray. To rule out other illnesses like pneumonia or bronchitis. Blood tests. To determine whether antibodies against mycoplasma pneumonia are present. Physical examination. To listen to the lungs and evaluate symptoms. Antibiotics like the following are typically used to treat walking pneumonia. Walking pneumonia is often treated with the common antibiotic azithromycin. Another antibiotic that may be used to treat walking pneumonia is erythromycin. Recovery requires rest and hydration in addition to antibiotics. To control symptoms, over-the-counter drugs including painkillers and cough suppressants may be utilized. Prevention and complications. Even while walking pneumonia is typically not severe, it can cause problems like inflammation of the bronchial tubes is known as bronchitis. Ear infections. Infections with bacteria that can lead to ear pain or hearing loss. Bacterial infections that produce sinus pressure and pain are known as sinus infections. Use these suggestions to avoid walking pneumonia. Obtain a vaccination. Pneumonia can be avoided with the use of vaccinations, such as the pneumococcal and flu shots. Maintain proper hygiene. Avoid direct contact with sick individuals. Cover your mouth when coughing, and wash your hands frequently. Don't share personal belongings. Avoid sharing personal goods with someone who has walking pneumonia, such as drinking glasses, lip balm, or utensils. In conclusion, one minor type of pneumonia that can be transmitted through the air is walking pneumonia. Even though it's frequently disregarded, understanding its signs, causes, and available treatments is crucial. Get medical help if you think you or someone you know has walking pneumonia. You can lower your risk of issues and stay healthy with the right care and preventative steps.